Healing is divine. And when you bring healing to a child, you are bringing new life and new hope to a family. Let us listen to the story of healing children. Welcome to Wordnet Productions. I'm so glad and happy to introduce to you our dear guest today, Paul Viviano, the President and CEO of Children's Hospital Los Angeles. Paul, thanks for coming and welcome.
It's a pleasure to be here. Thank you very much.
You know, looking at you and enjoying that smile, I'm sure is going to win a lot of people.
Well, it can't hurt.
Yeah, exactly.
Yes, yeah. But I enjoy the wonderful life that I've been blessed with, and smiling is part of my personality.
You know, especially when you bring a little smile in the face of families who are going through a lot of struggle because of their child who is sick. It means a lot, right?
It does, and what a calling it is for me, not to be a clinician, but to be a leader, to be an executive, to help run one of the greatest children's hospitals in the country, to create hope and build healthier futures, literally for hundreds of thousands of children every single year at Children's Hospital Los Angeles, and to be so compassionate. And the wonderful thing that distinguishes us and what brings great pride and a smile to my face is that we're also the safety net provider for all children in all of Southern California. So regardless of anybody's financial status or class, we provide care to that family and to that child. And that's not just today in our emergency room, but that's literally until you're 18 years of age, no questions asked. And it's a great source of pride to be able to do all those things, to provide such compassion and healing, and to provide care to all.
Thank you. Thanks for what you're doing, Paul, especially bringing that lease of hope and joy to the family. But my question right now is, listening to you, what led you or what brought you to this? Because looking at your bio, you had a long history of being in the field of medicine or medical field. Mm-hmm. I know you mentioned that already that you are not a medical doctor, but still being in the medical field, mainly in administration and organizational levels.
Right.
I see that you began already in San Diego. Oh, is that right?
I actually began in Orange County.
Orange County.
Working
for St. Joseph's Hospital.
Yes. St. Joseph. So I had the good fortune of working for the Sisters of St. Joseph of Orange, and running one of their hospitals, then St. Joseph Hospital. Then I became the regional president for Orange County, and ultimately the chief operating officer for the entire health system. And of course, that part of my upbringing, part of my personal religious beliefs were of course reinforced by working at a Catholic health system, and that ministry of the Sisters of St. Joseph, to care for the dear neighbor, to make sure the community's needs are addressed, resonated with me, and so it was a wonderful part of my career. And that led to an opportunity to work at the University of Southern California to be the CEO of their health system. And when I had the opportunity to go to Children's Hospital Los Angeles, and it was that mission of caring for all children, to have the opportunity to have the biggest impact on someone's life when they're young, and to be able to help cure, support, and allow a child to achieve their optimal, to contribute in a special way, combined with the mission, along with everything else that the hospital does from an academic standpoint, from a research standpoint, as well as from resonating with that calling to be compassionate. What a wonderful opportunity
Exactly.
to be able to
Yeah.
serve the needs of the community.
Paul, tell me, what is the main driving force for you to be in this field of medicine and medical administration? Because what inspires you?
Well, it's hard to know, it's hard to describe, but it's this drive to help others. It's this drive to be the best, and by being the best to serve the needs of others. And again, I don't have the skills to be a clinician, but to empower clinicians to make sure the resources are there, the administration, the infrastructure, the support fits my skill set and my commitment. And how fortunate to be able to work at these world-class places that are so community focused, are so academically oriented, meeting the needs of others, training the doctors and nurses of tomorrow, but most importantly to make sure the resources are available to provide compassionate care to those in need. And that just resonates with me.
Yeah. No, every healing, as I mentioned already at the beginning, healing is divine. Even when you consider Christ as a historic personality, you will find him moving from one place to the other, and the major part of his life was to heal people. And by doing that, he brought a lot of joy to people. And everybody was, crowding to him. They wanted to even just touch him. That's all they say. Because just by touching, they thought they would heal. So healing is divine. And it is so good, and it is so divine that we are able to also bring that kind of healing to the people. That's one of the reasons I asked you, what is your driving force? I'm sure working at the Children's Hospital, you have had moments of sitting with a family. I don't know if you do that, because as a CEO,
Very often.
how do you, can you narrate to us what are your emotional feelings? Because especially when you see a child, so innocent, but then going through a terminal illness sometimes, how do you relate with those people?
It's really interesting. I have friends that ask me, how could you work at a place like that? Because while it is filled with joy and it is gratifying and satisfying, every patient doesn't survive, unfortunately. And it's part of the delivery of care to really highly acute children. And yet the families know that we did everything we could. And even in the face of sometimes a loss, a sad outcome, those families know that there was not an ounce or any resource that wasn't provided to their child, that we did the very best we could, literally, to create the right healing environment. And so it can be challenging, and it is hard to sit with families during their hour of loss, that clearly the darkest hour of their life, when their precious child is ill and sometimes doesn't survive. We provide infrastructure for spiritual help and assistance, for social work to be available, to provide ongoing support services, psychological support services to support those families during those challenging times. And again, they acknowledge that everything literally was done within the realm of clinical care and modern science to save their child. And most of the children we treat obviously do survive, and it is a great source of joy. It's wonderful to see families go through that transition of, again, darkest hour, and then their child is healed. And of course that provides that hope and healing.
You mentioned hope and healing. I like to straight come to the hospital. Children's Hospital
Right.
and find out what are you mentioned already the different, quite many, services that you have
Right.
there in the hospital. So I like to hear some of
Okay.
those details, and
Sure.
then we will go into the
Okay.
rest of the things.
Yeah.
Please share with us
Sure.
about
So
those aspects.
Children's Hospital Los Angeles has about 350 programs. We're the largest provider of pediatric care in the state of California. We have about 800 full-time faculty physicians and about 8,000 employees. And we organize our care in service lines. So we have one of the largest heart institutes in the country, one of the largest cancer centers in the country. Again, given the size of the greater Los Angeles area, it's not surprising
exactly.
that they would be so large and so prominent and so visible. And many of the children that we care for are very severely ill, and they need care from multiple physicians. There's a program, the California Children's Services, and we're the largest provider in the entire state of those services. And the average child in that program sees multiple physicians. The average child sees 7 different specialties throughout their childhood. And so the coordination of that care is one of the hallmarks of what we do, given the severity of the children that we treat. And so, in combination with that family-centered care that we provide, so mother and father are always involved in the context of what's the optimal for healing, what's the best thing both for the family and the child. And the very earliest research on family-centered care actually occurred at Children's Hospital Los Angeles in the late 1970s. Something we're very proud of, and it's made a big difference, we believe, in the outcomes to have that level of support. So
I know the hospital also functions through the generosity of a lot of benefactors. I was looking at the website, and you had mentioned, I think, $15 million or $25 million that you received during the COVID-19 time, which is helping for some kind of a research.
Yeah.
So how about the kind of research that the hospital, because that's one of the major aspect of
Sure.
Children's Hospital,
Right.
providing to future,
Yes.
discoveries or
Right.
future inventions. So how do you manage that?
So those new discoveries, the focus on the development of new treatments and new cures is a big part of what we do. We have 350 funded scientists. So these are MDs and PhDs, some MD, PhDs, many of whom are both clinicians, care for children, and do research. And so again, we're the 6th or 7th largest pediatric research institute in the country, with that many funded scientists. So they get funding from outside agencies like the NIH, pharmaceutical companies, et cetera. And so just to put that in perspective, we do basic research, we do translational research, which is one of the focuses of our organization. And that translational research is how to develop those new treatments and new cures and provide it real time to children. And so today we have about 4,000 children on clinical trials in new medications for new treatments that many of them aren't available elsewhere. So that's an amazing number. I think it's among the largest in the country for sure. And those treatments, start with the most fundamental, and hopefully they get approved by the FDA to be more widely available. But that's one way to accelerate, to get more children on trials that are needy. So last year we treated about 600,000 children at Children's Hospital Los Angeles.
I was looking at the website and I saw, wow, all those numbers. We are going to take a break, but before taking the break, since we are already speaking about these things, I'd like to ask you one more quick question.
Sure.
Speaking about the funding, do you also receive funding from the state or from the federal government?
So Medi-Cal is a jointly funded program. About half of those resources come from the federal government, and about half come from the state. So Medi-Cal is a combination of federal and state funding. About 74% of our patients, so nearly 3/4 of our patients, are Medi-Cal. And so we're a very substantial recipient of of federal and state funds. The other 26% of our revenue comes from private insurance organizations.
Okay, thank you.
Yeah, sure.
We're going to take a short
Okay,
break.
sounds good.
And once we come back, I want to get into some more details about your personal convictions and a few things.
Okay, sounds great.
All right, so hope you are enjoying the conversation, the sharing with Paul. Don't go away. We have a lot more to share with you, very interesting materials. Stay with us.
Do you want to fall in love with God? I'm sure we all want to. The book of Psalms contains the directions. Thousands of years ago, people like you and me talked to God out of the depths of their hearts, revealing an intimate love. Psalms are the expression of the faith in God by people around 3,000 years ago. God was not a mere abstract creator, but was present, involved, and a real person of power and emotions. Now, when we read or listen to the Psalms, we can know the intensity of this love. Entering into the influence of the Psalms, we can find a path to know and love God. To know more about the Psalms, you should get a copy of Father Mike Manning's booklet, The Psalms. It will help you to understand the 150 Psalms better as he has categorized them. He uses the technique of acts: adoration, contrition, thanksgiving, and supplication. Get your copy today and know the categories. Learn to pray with the Psalms.
Call the number on the screen or email us. You can also get it through our website. Get your copy today.
Welcome back. We're having a wonderful sharing with Paul Viviano, the President and CEO of Children's Hospital, Los Angeles. And in the first segment, we shared about the hospital and the different aspects of the functioning of the hospital. At this time, I would like to start with something that you very boldly did when you took over the job as the President and CEO of the hospital, was to, in a way, remove a McDonald's restaurant that was in the hospital. What was it? Why did you do that?
So there are a couple of reasons, and it's important and an interesting story. One is because of the controversy around the food that you provide access to for children can contribute to health concerns, and so to be serving fast food in mass quantities probably wasn't the right public health connection with the Children's Hospital, where we're entrusted to care for children and look out after their health. And so that was the initial factor that led to that discussion. The second factor was the hospital had a very, very small, almost non-existent chaplain and support services, spiritual support services, excuse me, were almost non-existent, or very, very small scale. So we replaced the space that the McDonald's was in. We raised money to build a chapel, and magnificent interfaith chapel that's open 24 hours a day. It's there for caregivers, it's there for families, it's there for patients, for everybody 24 hours a day. And so we wanted to make sure it was a place to complement the clinical care and support with spiritual support, whatever that means to each individual. And so while I still get teased a little bit, mostly by nurses, that they miss their soft serve ice cream or their Big Mac or whatever, my response always is, yes, and now we have this beautiful place of spiritual healing for you to take advantage of should you need it. And so that usually quiets the crowd down a little bit. But it had its own controversy. But the outcome was magnificent to be able to provide these spiritual services in a much larger scale.
That opens up two questions that is immediately coming up, within me. Number one, the first question is, do you think today, the present situation, today, our lifestyle contributes to the different or varied kind of illnesses and sicknesses that we face and find in the society?
I think there are a lot of factors that contributed, and certainly our lifestyle
And when I say lifestyle, it includes both food habits and living conditions, living system, everything. So please,
of course, and the
go
answer
ahead.
is absolutely.
Yeah.
So that does span all the way from access to fast food, the emphasis on unhealthy food, drinking sodas, the things that contribute to health status in a negative way. Today in a shocking number, today in Los Angeles County, one of the largest counties in the country, 40% of the children to under 18, 40% are either diabetic or pre-diabetic. So that has it's a commentary around food status, access
Overweight.
to healthy food. Many of them are overweight. But those lifestyle choices do extend into a lot of other areas.
Now the next second that from you are removing the McDonald's is you said instead of the McDonald's right there, you made the space bigger and converted that into a chapel. What is the role of faith in healing?
Well, it's in the eye of the beholder. Some people think there's no role. I happen to believe that there is a very substantial role to our spiritual life and our spiritual belief and healing. There's lots of literature around survivability and response time and recovery time based on your fundamental religious or spiritual beliefs, whatever they might be. Not an advocate for one over the other in that context, but that spiritual belief does contribute to your healing process and does provide hope and does provide a context for that future state of healing that is special and unique. And so again, other people might rely purely on science, but
No, but I think, Paul, you are absolutely right. And of course, being a Catholic priest, I would definitely, endorse as well as, definitely speak for the same aspect, because I strongly believe. And not only that, you also mentioned the chaplaincy program at the hospital was weak, and you are trying to enforce that and bring that more into the hospital. And I think that is a very strong aspect of healing. When I am weak, I need more help, right?
Absolutely.
And illness is a moment of weakness, not only physical weakness, it's also a mental and psychological weakness of that individual who is sick. So also the people who are around that person, they all need support. And I think faith provides.
And the caregivers fall in that same category, because very demanding jobs, incredible rates of burnout, that is extraordinarily demanding to be a healthcare provider today. And that spiritual belief can make that resilience, that ability to translate those clinical skills into that resilience, so you can continue to provide care even in the face of great challenges, is an important part of care delivery.
Before we wrap up, I have one last question, Paul. I don't know if it is right for me to ask this question as well. Do you think today medical field is also made or is quite commercialized?
Oh, there's no doubt it's commercialized. There's no doubt that the vast majority of the medical industry, if you think of the GDP, about a fifth of our economy is in healthcare or healthcare directly related services. the vast majority of that industry is investor owned.
Okay.
So pharmaceutical companies, insurance companies, device manufacturers, et cetera, et cetera. Most of the providers are nonprofit, but all the other suppliers and support mechanisms are for profit. And healthcare has become a very big business.
How do we blend this and make it more in a way palatable or acceptable or user friendly to our common public?
So it's a great question, and you earlier referenced federal and state support. The federal and state governments still represent nationally, on a national basis, about 50% of paying for all the health care. And so no doubt that the Affordable Care Act has had a magnificent impact on access to health care, expansion of Medicaid and Medi-Cal programs nationally. So continuing to support that, part of our job working in children's health care is to be advocates for children to have access to health care. And so to assure that public policy does assure that every individual has access to health care is, I think, the most important thing we can do. We can't change the fact that there are a lot of investor-owned industries within the healthcare sector. That's great, it is what it is, but that advocacy that everybody should have access to health care in that great system and eliminating those disparities by providing that access is something that's very important for all of us to continue to focus on. And I think the nonprofit healthcare segment, hospitals, medical groups, et cetera, are the jewel of our healthcare delivery system, that we continue to be motivated by providing outstanding care, and that focus on addressing the community's needs is something it's proud to be part of, but it far transcends any one individual organization. As great as Children's Hospital Los Angeles is, there are a lot of wonderful providers in the community, and we're blessed to have them. And please continue to advocate for healthcare access for all.
Exactly, yeah. Thank you. Thanks, Paul. It has been a beautiful dialogue, a lot of information, and thanks for your dedication and care and love with which you are taking care of our families through Children's Hospital Los Angeles.
Thank you. Bless you.
Please know of our prayerful support always.
Wonderful.
To the hospital, especially to all those families and children who come there. I strongly believe prayer also has a lot to do, supportive factor to the healing. So we are with you.
Great. Thank you very much, and bless you for your fantastic work. Thank you.
And I hope you enjoyed this sharing with Paul Viviano, the President and CEO of Children's Hospital Los Angeles. Please do not forget to subscribe to our YouTube channel, and so also, if you can, support the ministry. Until we meet again, be safe and be blessed. Thank you.